Hi, I'm Dr. Lee Sheldon. I want to talk to you a little bit about the concept of Director of Dentistry. I brought up this topic before, and it's met with general approval, but also some questions. So let's talk about that for a second. First of all, those of you who are running a referral practice, and that's most of you, no, the last thing you want to do is go out and announce to everybody that you are the Director of Dentistry. No, that's not it. That's not the idea. When we're talking about Director of Dentistry, we're talking about future. We're talking about what we're looking for in the future. Now, the future, which many people are saying, is going towards group practice. I think you probably realize that. And when we're talking about training, we're talking about training people to run businesses both singly and then being able to develop those businesses into group practices. Will all of you develop into group practitioners? Probably not. But it's certainly something to aspire to. So when we're talking about an individual director of dentistry, what are we talking about? We're talking about refining your business skills to make sure they're absolutely pristine, that all of the systems are in place in order to be able to make your individual practice, your independent practice, as successful as possible. Now, you know, I talk about marketing and marketing directly to the patient, and I think that's where we're going. If you don't believe that, well, that's okay. But that's where I feel we're going, and that's where I've gone. And there are lots of avenues there to explore when you move from just the referral source and just market to the referral source to marketing broadly to the patient. There are many patients out there that have no idea what you as a periodontist can do. So certainly I encourage marketing directly to the public. It's worked outstandingly well for me, and I'm sure if done correctly would work outstandingly well for you too. But what that means is not just putting an ad in the paper and say, hi, I'm a periodontist, I can help you. It's being able to make sure that all of the systems are there to make sure that patient who calls, because after all, advertising is expensive, make sure that patient who calls actually is setting up an appointment with you, and that you are carrying the patient through being totally in charge of that patient, or being the director of dentistry for that patient. So you see, we're talking about refining our individual business skills. We're talking about taking full responsibility for the case. We're talking about making sure our practice does as well as it possibly can, so that if and when you're ready to run a group practice, preferably your own, where you're ready to bring restorative dentistry into your practice, you're totally ready to do that. Okay, I hope that clarifies it for you. If there are any questions, just contact me, and I'll be happy to iron out any difficulties or make any clarifications that we need to make. Thanks for listening, and I look forward to hearing from you.